Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my special guests today are the Roots Soldiers Against Tobacco Advocacy team, and we're reporting for the week of March 22nd, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 82,500 COVID cases and 1,369 COVID deaths. Daily case rates and positivity rates are continuing to come down, which is a very good thing. And Alameda County moved into the red tier about 1 week ago. So we will be keeping an eye on cases as the weeks go by to see whether this will contribute to an increase in cases as it did with prior reopenings. Case positivity rate overall continues to come down. And now when we look at what's been going on for the last 28 days, you'll see that case positivity rates remain highest in East Oakland's 94621, 94603, and 94601 zip codes, and now also in the 94544 zip code in the Hayward area. So while cases are coming down, they are not coming down the same for everyone. And with restrictions being relaxed and things opening up, we know that there will be more mixing, which means more opportunities for transmission. So what can we do to ensure that the rates continue to come down instead of heading back in the wrong direction? Now, we know that the best protection for individuals and their contacts are to get vaccinated if you're eligible and 16 and up, masking and spacing, and testing and quarantine. Now, once we get to herd immunity or community immunity, the vaccine will be protective not only for the individual who gets it, but also in terms of the entire community and limiting the spread. But we still have a ways to go. So where are we now with vaccination rates in Alameda County? Well, as you can see here in Alameda County overall, for those 16 and up, 34% have received their first dose and 19% are fully vaccinated. Now, remember that for herd immunity, we think we need roughly 70 to 80% of people vaccinated. And mind you, this was based on the main strain of COVID-19 that we were dealing with. This is not necessarily taking into account more infectious variants, but even in sticking with that 70 to 80%, roughly 20% of our population here in Alameda County is under the age of 16. So when we talk about needing to get to that 70 to 80% for herd immunity, this would include them. So in all likelihood, we almost need to vaccinate 100% of adults to get us there. Or we'll be needing to wait for vaccines to be administered to children. And of course, we are still waiting for an approved vaccine for those under the age of 16. Those trials are currently underway. So far, the most vaccinated city in Alameda County is Piedmont, where 53% of the residents have received their first dose and 33% are fully vaccinated. And Piedmont is far ahead of any other city in the county, the next being Albany at about 42% vaccinated with one dose. The least vaccinated areas so far are Hayward Acres, Ashland, Cherryland, and Dublin, where only 23 to 27% of residents have received their first dose and only 11 to 15% are fully vaccinated. And remember that the Hayward, Ashland, Cherryland areas are one of the areas that continue to be impacted with higher than average case rates and test positivity rates. Oakland is kind of in the middle at average, with about 35% of those 16 and up having received their first dose and 18% fully vaccinated. And we do not yet have this information broken down by zip code on the dashboard, so we don't know to that zip code level, but we do know that there are already disparities beginning to emerge with respect to vaccination access, and we are working hard to ensure that everyone who wants to receive the vaccine will receive the vaccine. Now, when we get to herd immunity, then we can say that those who are vaccinated are protecting those who are unvaccinated. But until then, all we can say for certain is that your vaccine protects you. If you have been fully vaccinated, so that means 2 weeks since you received both doses of Moderna or Pfizer, or 2 weeks after your Johnson & Johnson vaccine, the data is telling us very clearly that although you may have a chance of catching COVID, you will not get severely ill or die from it. Beyond that, there are several things we don't know yet about the vaccines. How effective are they or will they be against the variants? How long does their protection last? And how well will they keep you from actually spreading COVID to others? Now, there are reasons to be optimistic about all of these things, but truthfully, we are in a bit of a race. In particular, if we fail to reach herd immunity before variants that escape or avoid the vaccine take hold, then we could be looking at a very serious situation. And remember, the more COVID spreads, the more opportunities it has to replicate and the more opportunity it has to mutate. So stopping the spread remains paramount in order to stay ahead of these variants. In addition to the vaccine, other layers of protection for you and your group include a mask with adequate filtration that fits properly. Remember, you could have the best filtering mask in the world, but if it does not fit properly, the air along with any virus will go right around the mask. And so the type of filtration you have is irrelevant. So again, a properly fitting mask with good filtration is key. Testing and quarantine. If you believe you were exposed and you've not been vaccinated, isolate yourself, get tested in 5 to 8 days, and continue to isolate until you get your results. If you get COVID symptoms, get tested right away, even if you are fully vaccinated, and isolate until you get your results. If you test positive, please do what you can to get your close contacts to get tested and to isolate as well. Now, COVID-19 layers of protection in our indoor spaces include ventilation, that means fresh air circulation, filtration, that is through your HEPA filters or MERV filtration on your HVAC systems, and disinfection and sanitization, and that is in our high touch as well as our low touch surfaces. And now I'm pleased to introduce our Soldiers Against Tobacco Advocacy team, who are here to share with you how they have been working to address tobacco-related health issues in the city of Oakland.
Our Soldiers Against Tobacco Advocacy team are currently working on a smoke-free multi-unit housing initiative to address tobacco-related health issues in the city of Oakland. Our goal is to educate Oakland residents about the harmful effects of tobacco use, empower Oakland residents to advocate for community health, and bring forth a 100% smoke-free policy recommendation to Oakland City Council that will decrease the exposure to secondhand and third-hand smoke in multi-unit housing.
The problem with smoking in multi-unit housing complex is that when one person in the building smokes, everyone in the building is impacted. Smoke never stays within the smoker's unit. Instead, the smoke travels through windows, doorways, cracks in the walls, ventilation systems, electrical lines, plumbing, and anywhere it can seep through. The smoke enters into other units in the building where non-smokers live, which puts them at risk of developing health issues such as asthma, lung cancer, COPD, and more.
Approximately 50,000 non-smokers die from secondhand smoke exposure every single year. When tobacco is burned, the secondhand smoke does not simply disappear when it goes into the air. Instead, the particles in the smoke form a toxic residue called third-hand smoke.
Third-hand smoke gets absorbed by surfaces like carpets, drapes, fabrics, and furniture, and creates a sticky film on surfaces like walls, countertops, appliances, and light fixtures. Third-hand smoke has been found to contain cancer-causing chemicals that become more toxic over time, which presents a health hazard long after the initial smoke is gone. The chemicals that are slowly released into the air out of carpets, furniture, and drapes, and can be inhaled or be absorbed through the skin when contaminated surfaces are touched. Exposure to third-hand smoke may increase the risk of tobacco-related health issues like asthma and cancer. Tenants who move into units that have been smoked in will be exposed to these hazardous substances for long periods of time. Units that contain third-hand smoke can cost a property owner anywhere between $5,000 and $15,000 to restore. The home is one of the main places where families and individuals are exposed to secondhand and third-hand smoke. And while children and adults have stayed home to help stop the spread of COVID-19, those who live in multi-unit housing are now facing higher risk of health issues due to increased secondhand and third-hand smoke exposure.
To add fuel to the fire, we have learned about COVID-19 is that it is a virus that attacks the lungs, and smoking tobacco products lowers the lungs' immune response to infections. This means that people who smoke or are exposed to smoke are at a higher risk of developing severe COVID-19 symptoms.
Our Soldiers Against Tobacco advocacy team conducted a community diagnosis where we surveyed and led focus groups with 145 East Oakland residents to get their opinion on issues regarding secondhand smoke and smoke-free multi-unit housing policies in the city of Oakland. Our key findings showed that 95% of the people we have heard from live in multi-unit housing, and 50% of them were smokers of tobacco products. 56% of the residents we talked to are burdened with financial barriers that could potentially prevent them from being able to freely move out of their unit if or when exposed to secondhand smoke. 52% stated that they smell secondhand smoke from other units at least a few times per month, while almost 70% were not aware of their health or someone in their household's health being impacted by secondhand smoke.
During our focus group, the majority of participants stated if there were a smoke-free multi-unit housing policy in the city of Oakland, it should be fair and also not displace people. One of the participants in the focus group who was a smoker stated, "We as a community have to be very sensitive and aware as to how some of us may have fallen victim to tobacco or have those types of habits, but be sensitive to people and not contribute to displacing more people within our own communities." Another participant who is a non-smoker stated, "I agree that's a good idea to implement a policy, but on the other hand, I think they have to do it in a way that sort of creates that transition. But I just don't feel like it's a good idea to just all of a sudden kick a bunch of people out because they have a habit of smoking. It's a very hard habit to get rid of."
Based on our community diagnosis, we are recommending that Oakland City Council enact a policy where tenants and property owners of multi-unit housing adhere to a 100% smoke-free multi-unit housing policy in all units, balconies, patios, and common areas that is fair for all smokers, non-smokers, and property owners. This policy will decrease exposure to secondhand and third-hand smoke in multi-unit housing, protect tenants who are addicted to nicotine from evictions and other harsh punishments like misdemeanors or jail if they smoke in the building, reimburse landlords and property owners for unit turnover cost, and overall provide a healthier environment for all families and individuals in multi-unit housing complexes.
Join in our efforts to support a fair, smoke-free multi-unit housing policy in the city of Oakland. If you would like to learn more, please contact our Tobacco and Policy and Advocacy Program Coordinator, Kiona Purcell Roots, at kiona@rootsclinic.org. Thank you.
Thank you for that, soldiers. As our Soldiers Against Tobacco mentioned, the home is one of the main places where people are exposed to secondhand and third-hand smoke. And we know that a lot of us are sheltering indoors, and we may be sheltering indoors with smokers or have smokers in adjacent units. There have been a lot of sporadic and conflicting reports about the relationship between smoking and COVID, but we do know for sure that smoking weakens the immune response needed to fight off infections, especially respiratory infections, both viral and bacterial. And this research letter, reported recently in JAMA, the Journal of the American Medical Association, summarizes a review of Cleveland Clinic's COVID-19 registry of about 7,000 patients in Ohio and Florida, which included a large portion of non-smokers as well as current and former smokers who got COVID-19. It concluded that cumulative exposure to cigarette smoke was associated with more severe outcomes among those who tested positive for COVID-19, including higher risk of hospitalization and death. When they compared those with heavy or long smoking histories with those who had never smoked, those with smoking histories of more than 30 pack years had more than double, actually 2.25 times, the the odds of being hospitalized due to COVID-19. So those who are heavy smokers had more than double the risk of being hospitalized, and that was even after they adjusted for age, race, and gender. In fact, the CDC's Advisory Committee on Immunization Practices advises that smokers should be vaccinated in phase 1C, which is ahead of opening up the vaccine for everyone. Now, whether that actually gets implemented or not is up to each state, but a couple of states like New Jersey and Mississippi have gone ahead and prioritized smokers due to their increased risk. Either way, if you are interested in quitting smoking, we know it's not easy, but there's no better time than now, and there are resources out there to assist. Check with your primary care doctor or your behavioral health provider to see what kind of support might be right for you. Now, here's our best advice one more time. Increase ventilation in any indoor space. Ensure proper filtration of recirculated air. Avoid crowding. In the absence of windows or central air, procure a portable HEPA air filtration unit appropriate for your room size. Don't share your air. Shelter indoors as much as you can whenever you can, but only with members of your household. Mask up, space out. Always protect your elders and those with underlying conditions. If you think you are exposed and you are unvaccinated, do not go to work, do not gather. Isolate yourself, get tested in 5 to 8 days, and continue to isolate until you get your results. If you have symptoms, get tested right away, whether or not you are vaccinated. Continue to isolate until you get your results. If you test positive for COVID-19 and you are in a high-risk category, please inquire about monoclonal antibody treatment, which is an outpatient treatment. Take a multivitamin supplement and consider additional vitamin D supplementation, as we want to avoid vitamin deficiencies in anyone so that we can have optimum immune functioning. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10. See you then.